Okay, here we go. Assalamu alaikum, everybody. Um, uh, Welcome everyone on board. Uh, Actually, the topic of today's discussion is like we in our last session we were just discussing that anesthesia has very little anesthesia, and anesthesia has everything other than anesthesia. So there's so many aspects of anesthesia. So today, my aim will be to just to have a case based discussion. Okay. Um, uh, uh, just a second. Okay. So I'm sorry. Actually, I just want you to understand that, for example, how to train. Like today, my aim is to how to how we should be having our training. Unfortunately, whenever we join a training, we are we have just switched off our mind, and we are just thinking that because the other people who are there before us know everything and we don't know anything, so we have to follow them blindly. This is the biggest mistake, and this is the biggest problem we do. So unfortunately, we just don't use our own brain and then follow everyone, follow others blindly. I'm not saying that they are wrong. They may be right. Why don't you use your own intelligence? Why don't you use your own brain? Why don't you use your own capabilities? Because this is the biggest problem. Because especially in the people in our part of world where we don't have proper training setup, we don't have proper resources. We are a lot of time we are getting trained at our own. Okay, this is a hard reality because unfortunately the responsibility of the people who are taking our becoming our supervisor, unfortunately they are not fulfilling their responsibility. They have a lot of excuses for that. We are busy, we have academic position, we have administrative position. I'm sorry, if they are becoming supervisor, they are supposed to train us, but unfortunately or fortunately you cannot change them, you cannot change the whole system. So my like today what I will be trying to do is to make yourself equip your brain and your mind that you are able to extract the things which you have to in the low resources and where we are not getting the proper training. So like this is the first point which I wanted to highlight. The thing is that, like our anesthesia specialty, as we discussed in our last discussion, that we start our anesthesia management in pre-op, we continue our care in intra-op, and then it reach to the post-op. Okay. So first of all, whatever, because you can divide it into a number of aspects. One is academics, okay, and one is practical. Okay. So practical things, unfortunately, we think that only the skills, okay? But actually, the most important skill is the professional skill and communication skill. Unfortunately, this is the most important thing which you should, all of the trainees should learn. And the question will be that how to learn. This is a big challenge because this is against your sometime at times against your personality. It at times against your, for example, if you are working in an environment where you are not fully familiar with the situation. Of course, the majority of people, we are getting training in our own hospitals or own cities, but this problem will be even further if you don't have you are not able to understand the mentality of the people who with whom you are uh, interacting. Then another important with the same communication will be that there are two group of people. There are one group of people who are actually already trained. Wow, how you will say how? Because they are working in that XYZ department as medical officer for some time, and now whatever habits, good or bad, they are actually they have become chronic. They are not able to modify or change. So unfortunately, they this will be one group of people who are already knowing everything, and they are already trained actually in their books, okay, or in the books of other people. And there are other people who are coming as a fresh, and they don't have much of clinical experience. So if for all both of categories, unfortunately, the communication will be a big problem. So the one part of communication will be what you are communicating with the patient or with the patient family. This is one sort of communication. And other communication is among your colleagues, okay, and among with the seniors. Okay, so this is very important part of your training. How to communicate. Like for example, if you are doing like a case, because I'm telling you a practical aspect, the number of time we are doing the cases at our own. Like the biggest problem which I faced when I came to Saudi Arabia, that fortunately or unfortunately, because we used to work alone. We used to work majority of time in the evening. Yes, morning part is different, but in the evening part or night part, or a number of people, we are doing private practice as well. Right from the start of our career, usually we are alone. So biggest problem I used to face is how to communicate the status of the case, the problems to my senior fellow. This is the biggest problem. So for that thing, you need to identify how to pick a problem and how to communicate with the person which is not there in that room. Maybe even if he is sitting in his office, even then, if he is not standing with you, you are alone. And it's very difficult for you to learn how to communicate. So this is the a big challenge. How you can learn? By making your observation skill a lot good, okay? And of course, by your knowledge. Okay. And because all our anesthesia care is going with the monitoring. So you have to be very good in monitoring so that you know what is going on. Only then you will be able to communicate to your senior colleague or your so this is a very important part. Of course, this is a whole like you can say study how to develop good communication skills. But please don't forget that you will be learning endotracheal intubation, you will be learning IV line, and you will be learning spinal and epidural and everything. But if you don't know how to communicate with the patient, with the family, with your colleagues, with your seniors, it's the most it's the most important thing. Because if you don't learn while you're training, it will be a big problem for you. Like I suffered a lot because I was not properly trained for this thing. I was not good in communication like all of our colleagues. And now when I'm looking back, and now when I'm communicating, when I'm talking to majority of my juniors through this WhatsApp group, I am finding a lot of time people are not able to communicate. Okay, so please do focus, learn at your own how to be gentle, how to be expressive, how, of course, don't lie, don't hide anything. It will be problem for you later on in your life or your career. Or of course, it's unfair if you are not able to tell. Like I will tell you personal experience. I was just doing like a house job. Okay, I was a house officer only 3 months of my training, my internship. And because in anesthesia, in 3 months, after 3 months, people are giving spinal and endotracheal intubation like anything. I did a wrong medication. I gave a wrong medication to a patient. I will not go into detail, but at that time, I one way was that I ran away because there was no person other than me and the patient. There was not even nursing staff. But fortunately or unfortunately, for I would not say unfortunately, I immediately informed my senior. But I was confused. I did not have this skill what to do at that time. So it was a medication which could have caused cardiac arrest or bradycardia. I give atropine. That was my whole knowledge at that time. And I went out and I informed my senior, I have done this mistake. Okay. And of course, we handled the situation, and that was the turning. Of course, I was very lucky that that senior even gave me a lot of courage and even asked me to give spinal later on after 15-20 minutes when we ruled out what has happened. Okay. So that's what I would highlight, that please, very good. You should be very good in communication skills. This is one part of our, then what next? The skills, of course. For skills, a few words, how to learn the skills. Okay, how to learn the skills. So actually, unfortunately, like before, again, I will say that because we go without guidance, we do practically first and then read about it. So please, my humble request, read about that procedure first. See, watch out videos, because when we were trained, the videos were not there. Now this is era of artificial intelligence and chat GPT and meta AI and everything. So it's very easy for you to read about it, to watch out videos, whether it is IV, whether it is LMA, whether it is whatever you want to do. My request, at least have 10 different videos of that procedure. Even if you have, even if you have not done it before, again my request will be, do it, so that so many things we learn every day, different techniques, different ways. So for learning skill, my suggestion will be, read, watch out videos. And another thing, a number of time you will be very eager to do it yourself. Again, my suggestion will be, watch others first, what they are doing, and note down each and every step what they are doing, because you will come to know that when you will be doing the same thing, you will be doing the same mistake. So that's part of learning, because believe me, I am doing right now, even right now, that in last 2 years I'm working in a setup where I have a lot of residents around me, which I did not have before, because right after my training I came to Saudi Arabia. So I did not enjoy this thing, but now alhamdulillah, I am learning a lot by doing others doing mistake. I'm learning. Oh, I used to do like this. I used to do like this. So watch others, what they are doing. This will also be your learning. And again, if you fail, don't get disheartened. Failure is the first key towards success. If you fail, don't worry, just try to see, maybe yes, if you have a good teacher or good one around you, you can learn, you can ask, what mistake I did, don't hesitate. Okay, because there will be two sort of people around you. Again, I'm sorry, this is a very important point. There will be two category of people around you. One people will be no, 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 like they will be making a fuss for nothing, and you fail. You will have one category of these people, and other people will be who are not interested. Okay, so I wish that you find the third category, who are actively observing you and then no, giving you positive response. So if you are fortunate to get the third category, you are very lucky. But actually, you will be dealing with two different categories more frequently. That there one will be that they will be standing at your head side, and actually they will be the reason for your failure in one way. And the other people who will not be there, and you are doing either unsupervised, or they are not interested what you are doing. If you succeed, fine. When you will say no, they will come and do it. So this is very important, but you have to adjust yourself accordingly. So for learning the skill, read out, watch out videos, watch others doing, and if you fail, you should be trying to get your. And another thing, another way I can tell you, that if there is no other contraindication, there is no problem, you can ask some of your colleague to make your video, how you are doing that skill, and then you can watch it out yourself, what did mistake you did. So that will be a very good way to actually to learn that skill. Okay, so this is few words about how you should be learning the skills, and believe me, don't worry about it. Doing the skill in wrong way 100 times is better than doing it only once but with the correct way. Okay, so please try to focusing on the quality rather than quantity. I have seen a lot of people trying to do arterial line, and their technique is wrong. Okay, and now number of time they will succeed, but actually if their technique is wrong, they will be stuck somewhere. So this is, of course, we all learn every day. So this is my few points about. So we have discussed about two, that practical skills, practical procedures which we are doing. That will be, you should make a list and try to focus one by one. IV line, arterial line, CBP, endotracheal intubation, spinal, epidural, blocks. Okay, and so many things. But so it will be better for you to go gradually, go step by step. Okay. And another thing, once you do it, you have to clean the garbage. You have to remove the sharps. You have to fix that thing properly. And another thing, you should be knowing the end points of any procedure. Okay. End points mean if you have taken an arterial line and you did some mistake, if you have given a block and you don't know how to manage the next step, you will be in trouble. So you should be knowing the end steps. Like once you put the IV line, I'm just talking about only IV line. If you have put an IV line, this is equally important step is to fix it properly. Okay, and then you see that if it is going properly. I'm giving you one example. Similarly, if you have put an arterial line and while fixing it you don't flush it, maybe it is blocked. Okay. Or fixation, during fixation you kink it, and now the reading is not coming. So many times, one day I put an arterial line, I went out unfortunately early before they were fixing, and I came back and they said, no, arterial line is not working, and the patient was covered already. Okay. So we suffered, and then at the in between, when I had a chance to see it, I found it was kinked. So I just removed the tape, and I'm just telling you that these are very important. So this is two things. Then with reference to cases, okay, whatever cases we are doing. So uh, yes, what I will suggest you, because actually usually we have practical conduct of anesthesia cases, and so three categories you can divide the situations in three. So one will be the patient group. Okay, one will be the patient group. The second will be the disease. Okay, and the third will be the surgery. So whatever case you are doing, even if you are a junior resident, try to focus on these three things. Okay. Patient group will be like, for example, patient is pregnant, patient is elderly, patient is obese, patient is short of ear, like not able to listen, patient is blind, patient has difficult IV lines. Like these are group of categories of people. Patient is a smoker, patient is alcoholic, patient is drug addict, patient is delirious. So you can make group of, like this is group of patients. Again, I repeat, pediatric, pregnant, adult, obese. So these are categories of patients. So try to make your approach that one thing is category of patient. Yes, even because diabetes and hypertension is so common, so you can even put it in disease as well as, but you can also put it in patient groups. Okay. So in our like previous discussions, which I you regularly do, in so you will find patient group based discussions. So I have made discussions, pregnant patient for anesthetist, pediatric patient for anesthetist, a smoker for anesthetist, and thereon. Okay, I have tried to cover a number of things. I have done. Some of them are still missing, but I have tried to go in this way. Okay, so whenever you are doing, so you should be looking at this point first. The second thing is disease. Okay, so of course, as much you will be practicing, as much you will be looking at the diseases, but make your approach like that. Again, I repeat from where we started, that when we go to a training system, they give us, like for all anesthesia resident, at least if I talk about Pakistan, there is a curse on our residents to get this bloody book. I'm sorry to use this bad word for it. It's not a book. It's a terrible source for the residents. And they say, please read out the first 13, 15 chapters of this holy book. Okay, unfortunately. And this is the biggest problem. And you are not understanding anything. The practical conduct is totally different than what you are trying to read. You are reading physics and you are not understanding anything. You are reading pharmacology for the sake of pharmacology and not understanding anything. You are reading the chapters of physiology and you are actually practically not understanding anything. Unfortunately, this is absolutely wrong way. People tell like this, we are getting the basics. No, it's not like that. you are becoming an anesthetist, you are, or if you are becoming doing a training in any specialty, you are becoming a clinical specialist rather than a basic specialist. Okay, so even if you have to learn the basics, you have to correlate it with the patient, like you can correlate with the patient groups. Yes, a lot of things you can put in one detail, one, like you have to fill the boxes, rather than if you are 1 week you are trying to study physiology, believe me, the output will not be that good. If you are understanding, you can put it in the, if you have to do a COPD patient, try to understand the respiratory physiology. And if you are understanding, you are reading about respiratory physiology, try to read about the respiratory pharmacology, try to read about the respiratory monitoring. So the respiratory investigations, okay, how to evaluate. Actually, I have done this as well. So in our YouTube channel, you will find I have discussed in detail, because that's what my aim is, to make our understanding in a different way, other than books. So actually that's the most important thing, that how you deal with a specific condition, how you evaluate, because your questions when you are evaluating a patient in the clinic or in the pre-op, actually that is the time when you are making up your mind what you have to do. So for that background, you should be knowing what is the reason for asking every question, what is relationship with the physiology, what is relationship with the pharmacology, what is relationship with that disease. So if you know this, then you will be interpreting the investigations. Then according to this scenario, you will make your plan for anesthesia. You will avoid the medications which are precipitating that specific problem. Like for instance, I'm giving you an example. If your patient is asthma, you will avoid medications which will release histamine. This is one example. So now histamine releasing drugs will be your aim, or any maneuvers which will trigger the bronchospasm. That will be light plane of anesthesia and everything. So your whole management will change according to the problem. So if you are not good in understanding this patient group or the problems associated with it, you will be in trouble. So that is my advice will be that go learn the patient groups practically. A patient with respiratory disease, patient with liver disease, patient with renal disease, and then go back through the physiology, pharmacology, relevant anatomy, relevant pathophysiology, relevant investigation, relevant monitoring, relevant sign and symptoms. Okay, just make it in a bulk. That will help you, believe me, that will help you a lot. Similarly, I have told you disease and about surgery. So every surgery, for first of all you have to identify how urgent that surgery is. Okay, how urgent, because all optimization or evaluation or your response will be according to the urgency of the surgery. If the surgery is urgent or emergent, you cannot have uh, asked for echo, you cannot ask for chest, like you will, your management will be according to the urgency of the surgery. Okay, so then you should be knowing what is the reason for surgery, why they are doing that surgery. Whenever they are telling you, even as a junior resident, you should be looking at it. What is the condition? Like, for example, I will give you one example of cholecystectomy to identify what you will be asking. Cholecystectomy, of course, we consider it as an elective procedure, but now the trend has changed. Even they are doing lap chole in acute phase, and rather they try to do it as early as possible, because they now the new research saying that if you are doing it in acute phase, actually the advantage is that the outcome is actually better. Yes, intraoperatively you may have a challenging environment, but actually they are doing it. So the traditional teaching is as an elective case, so I will be telling you as an elective. So whether it is, you will ask the surgeon whether it is uh, cholecystitis or it is cholelithiasis, how long is the history, if are you expecting any biliary involvement, are you expecting a rupture? Are you expecting pancreatitis? Okay. So this is all medicine. Because if the stone slips out and go have morning walk in the biliary tree, you might have jaundice. This stone can also trigger pancreatitis. Okay. The patient may be suffering a lot, and maybe the history is prolonged. Maybe the patient has been converted into a carcinoma, believe even. Okay. So that is only, they are telling you only, doctor, we have to do a lab chole. So you are the one to ask the reason, please. This is a message not only for this surgery. Ask for everything. You will find in every case, you will come to know they are doing a fracture. Okay. So you will be surprised that even then, even in the fracture, hip fracture. Okay. So your questions will not finish there. You will ask, okay, how the fracture occurred. Was it a trauma? Okay. Trauma. If you listen the word trauma, you have to rule out all other traumas, whether it is head trauma, neck trauma, or any other trauma. Even then, if, for example, even if there is only fall, I hope you are understanding and listening to what I'm saying. If even if there is a fall, the patient you heard, oh, the old mama fell down in the bathroom. Now, even you have to clarify even this point, because if you don't put your stress on this small point, you will miss. You will ask whether the patient slipped or the whether the patient had and became unconscious and fell down and has fracture, because this will totally change your management. You have to rule out, of course, if it is, you cannot delay it forever, but it should be in your mind. Maybe it was some cardiovascular event, whether it was some neurological event, whether it is some arrhythmias. Okay, so it can be anything. So you have to rule out maybe whether it is some endocrine problem. So the point is that whenever they are asking for any surgery, please, this is a resident stuff. But unfortunately, even if you have passed the exam a number of time, you may miss this thing. So you have to know what you need to do for these things. So reason of the surgery, the urgency of the surgery, and the rest of the things will be according to the bleeding risk, according to the position. Okay, which position they are doing the surgery. As a junior resident, you should focus always which position they are doing the surgery, which if any risk of bleeding, okay, any critical step. So I have actually chalked out steps what you need to see for surgery. But the message which I wanted to give you, look into the details of surgery, why, where, when, how they are doing that surgery. Okay, so this is very important point, the disease and patient groups. So this is the most important thing you should be knowing. And then of course, the some of the very important thing is interpretation of monitoring. Okay, so there is all of us know there is one standard one, standard two monitoring. And then you should be focusing, you should be reading as a junior resident, you should be knowing why we are doing this monitoring. And you should be knowing, if, like, for example, if I ask this question, if heaven anyone wants to answer, actually I have written already. If you have to choose one monitoring, is end tidal CO2, because end tidal CO2 will tell you even cardiac output. It will tell you about circulation. It will tell you about the ventilation. So actually it's something very important. So then you should be thinking, your as even as a junior resident, you should be knowing, are we going to do something special? Are we going to do urine output monitoring? Are we going to do neuromuscular status? Are we doing this neuromuscular monitoring? Are we doing neuro monitoring? There is two different things. One is neuro monitoring and one is nerve monitoring. Okay, nerve monitoring, of course it's not done by you, but in a number of procedures they are doing nerve monitoring. Like for instance, in mastoid surgery, facial nerve; parotid surgery, facial nerve; thyroid surgery, recurrent laryngeal nerve. Okay, so they are doing the, and for actually this is something different, that for that surgery we put a special endotracheal tube which has an electrode. Okay, so in any surgery in which they are doing nerve monitoring, you don't have to give muscle relaxant after the initial dose. Okay, you will not use the muscle relaxant, and you will keep the anesthesia on inhalational agent and TIVA. You can use some good opioid infusion. You can give Presidex. You can give propofol infusion, or you can use the thing which you will not give nerve muscle relaxant. So this is one example. Okay, so if you know about these things, you will be able to conduct the anesthesia. So, and another message for you, look into the monitoring. So, any case you are anesthetizing, you should be knowing what special monitoring you need to do. Okay. So this should be your task. then similarly the next steps will come, and actually this is the general conduct of anesthesia: which induction agent you should give, which muscle relaxant you should give, what fluid and how much fluid you need to give. This is all part of basic part of training. Okay, so if you are able to understand this thing, this will be every day there will be a new patient every day, and every day you have to pass through this thing. Is there any problem in airway? Is there any special monitoring required? Is there any special challenges in a special patient group? This is how you will be making yourself train. Okay, so every case you should be thinking, and believe me, you can do it. There are, you can make your own way. I have just made like we'll say a sample. I shared this thing a number of time, like uh, like this is for related to surgery. I shared this document a number of time. This is, you can make your own. Okay. Similarly, I have written here what you see, like pre-medication monitoring, induction agent, muscle relaxants, maintenance, analgesia, fluid therapy, recovery, and post-op. So make, you can make it your own. I have just given you an idea. So make a format, and whatever case you are doing, try to, because anesthesia, that's what actually the thing is, that anesthesia, that's how anesthesia is very easy, because in anesthesia there are default things which are there in every patient. Like every patient you have to understand any problem in the respiratory system and cardiovascular system and liver, because all the medications will be metabolized by the liver, excreted by the kidneys. Okay, so these are common things, and you will find that 10-15 cases, if you do like this with this approach, things will be totally different. Okay. Similarly, when you are evaluating the patient, you will be looking at the cardiac risk, pulmonary risk, renal risk, aspiration risk, PONV risk, airway management, any special monitoring, as I mentioned to you. Like for example, if the patient has a history of diabetes, okay, the surgery which is you are taking is a lot of fluid shift, or surgeon is asking for hypotensive anesthesia. Okay, so now this will be a renal risk, because all this can lead to renal failure. Similarly, if you have a pregnant patient, or if the patient is full stomach, okay, or if you are giving any condition in which the gastric volume is more, and emptying is slow, okay, and so that will be at risk of aspiration. Of course, there are other medical condition, liver problem, kidney problem. So there are so many things. So you will be anticipating accordingly. So in every patient, you make ticks, you open, and even if anyone is around you, you can discuss, you can think about it, and I am there to help you out. If you take any case, for instance, and fit it in this format, believe me, I can guarantee you, even if you do 10 cases, your approach will be changed, your approach will be totally changed. And that is how you should be, and I don't think so there is nothing to do with the resources. Wherever you are, your mind is with you. You are so lucky that you have a mind which it's all yours. If you use it a little bit, you will be able to handle this situation. Okay. So this is the basic message which I wanted to give you through this, and of course, gradually, step by step, you will learn that post-op problem. But this is a format. Any patient, any surgery, you can put these things in it. Okay. So this is main theme I wanted to tell you. I have actually discussed with different uh, like uh, uh, in a different way a number of times. Of course, history taking is a different thing. In the channel, actually, in the playlist, I will show you that I had patient specific conditions. Just a second, please. Any questions, please? Anyone wants to ask any question, any comments?
Hello, Doctor.
Yes,
I am Professor Jas Muhammad Salman from Iraq.
you're welcome, sir.
It is actually a very nice subject and presentation, and it is valuable for the new trainers,
Sure.
especially in districts and tertiary hospitals.
Yes.
Uh, this is related to a subject titled patient safety. I gave a seminar about
Okay.
patient safety. Therefore, I suggest when there is limited uh, resources and lack of supervision, one can collaborate with colleagues, with other centers, especially with availability of online contact. Communication is very important in these situations. This is my suggestion to decrease any errors, any impacts. We know when somebody work alone, he is exposed to fatigability. This is one factor that come from lack of supervisions and resources. Therefore, collaboration, online communication. Now, this webinar is a type of collaboration. When I have a patient, a risky patient, uh, like hypertensive with end organ failure, I can make online webinar to discuss the patient, to discuss the case, and overcome any problems, even when any complications happen. Therefore, here in Iraq, we always make this online communication, even with the WhatsApp call, video call, texting. These matter very helpful, different from past years before 2 decades. These are not available, and we cannot communicate with other experts. And thank you very much for you and
Dr.
for the listeners.
Yes, Dr. Jasim, it's been an honor for me as a Pakistani that you are joining us, and thanks for your comments. Actually, that's what I invite everyone, because now we can use this availability, as you mentioned, that now we are in a global village. Okay, like we can communicate with anyone anytime, and the most important thing, sir, is that we should throw out our ego in the dustbin, because if we think that we know everything, actually that is the time when we go down. So we should not hesitate to discuss, ask, and share anytime. So that's the reason for a lot of problems, that we don't either we don't know anything, or we know the wrong thing. Okay, and then we are hesitant and we have ego. Ask. So that's create the biggest the problem. So I'm really thankful to you. I have put my number here. I would be very happy. You just drop a message to me on WhatsApp, and inshallah, I will be in touch with you. And the purpose, believe me, that because I am also from a poor and low resource country, I would say, a number of hospitals in the public sector, we don't have the good facilities. Okay, I was lucky that I came to Saudi Arabia right after my training, and I worked. Allah sent me to the best hospital, not only of Saudi Arabia, but one of the best hospital in the world, that is King Faisal Specialist Hospital and Research Center. And actually, I learned a lot, and that's why I feel that this is my moral responsibility to spread this message to my junior colleagues and my colleagues anywhere wherever they are. So that's actually that's the aim for me, to get everyone involved. Okay, And I will be very happy, Dr. Jasim, that you take the lead and you teach us any topic whenever. I will contact you, inshallah, and hopefully you will be conducting some session with me, inshallah. So I'm really
Thank you.
thankful to all of you for joining. But do you know what's the problem? The problem is that this is a message for all my colleagues back in Pakistan and anywhere. When they pass the exam, they run away. They are not interested because they think that they know everything. A lot of people who leave my anesthesia knowledge group, I just send a message, are you not interested in anesthesia knowledge group? They say, no, we have already passed the exam. So that's the problem. The thing is that I have passed the exam 10 years ago. I'm not in a teaching hospital. I'm not in why I'm doing this. This is the reason which I also want you to understand this thing, that if you want that you learn every day, this is the best way, is that you teach. The best way to learn is to teach. I was nothing. So whenever I
Yeah.
have feeling anything like that I am, so I just try to go back and think what I was 10, 11 years ago. So then and another thing, I try to feel for the people who don't have the resources, like as Professor Jasim is in Iraq, and I'm 100% sure the things are not very good over there. So it's our moral responsibility. The Jennifer Rose, she's I Jennifer, which from which country do you belong? uh, I'm sorry, I forgot. There are some of the people from African country who at times join our session. So it's been an honor for me. So thanks a lot. Inshallah, yes, you see Myanmar. So Jennifer Rose is from Myanmar. So believe me, as a Pakistani, it's been an honor for me to have all of you on board. So thank you very much. And whosoever is listening, send the message to my lazy Pakistani colleagues who are not attending the session. So this is all for you, and I'm available 24/7. You can drop a message to me, and if we have more people like Professor Jasim, we can spread our work, because my aim is not to earn money. My aim not to have any publicity gesture. This is purely to help out my juniors, colleagues, seniors, helping them to be a better anesthetist. Okay, so thank you very much. And the last word I will say before I go is, the day I repeat this, now people who are attending me maybe listening this word again and again, the day of your life when you wake up in the morning and sleep, finish the day without teaching anything you know the other doesn't know, and without learning anything which you know don't know before. So
Yes.
your aim should be either to teach or to learn. Okay. So thank you very much, all of you. Inshallah.
When I was in my postgraduate training, my supervisor every day said you should have every day lesson.
Yes.
You can learn from any skill, new skills. By the way, I am available in the group, WhatsApp group, Anesthesia Unlimited. Anyone wants my help, I am available all the time.
Yes. So
Thank
Dr.
you so
Jasim,
much.
have you noted down my phone number? It's here. If you can just note it down, so that I can
Okay.
contact you.
Just, just, I am available in the group, and I write here.
If you can also drop your number here.
Yes, Professor. Yes, this is my. I place it in the chat.
Okay. Okay, sir. Thank you very much. So inshallah, we will meet again
Welcome.
with some other topic, inshallah. Okay.
Okay.
Bye bye.
Bye.